Hi, I'm Claire Bianco. I'm the Client Services Coordinator at Home of Hope Cancer Wellness Center in Dixon, Illinois. Today we're going to be talking about navigating cancer diagnosis and treatment. Just as cancer affects your physical health, it can bring up a wide range of feelings you're not used to dealing with. It can also make existing feelings feel more intense. They may change daily, hourly, or even minute to minute. This is true whether you've just been diagnosed or are currently in treatment. It is important to note that all of these feelings are normal. So first we'll address shock. Shock is often the first reaction to finding out that you or a family member have cancer. Your cancer has come back or your cancer is advanced. It can make you feel confused and numb and unable to know what to think or feel. The next feeling we'll talk about is fear. A cancer diagnosis is scary. You may feel at times as if your life is out of control and you don't know what the future holds. This is especially true soon after diagnosis, but these feelings can come and go at times during your treatment and after. Denial. Denial is the mind's way of coping with painful facts, such as the diagnosis of cancer. No one chooses to be in denial. In some ways, a short period of denial can be helpful because it can give you time to feel less overwhelmed by the news. Anger. Anger is a common response to something that feels very unfair. You may feel anger toward the cancer itself, healthcare professionals, or friends and family who are healthy or don't understand what you're going through. Guilt. People sometimes blame themselves for their cancer. You may wonder if you could have done something to prevent it or to discover it sooner. You may also feel guilty about how your illness affects your loved ones. Many people experience guilt, and it's important to realize that cancer is not your fault. No one deserves to be sick. Sadness. Many people feel sad after a cancer diagnosis or while being treated for cancer. It's normal to feel sad or to be tearful, frustrated, or discouraged when dealing with stressful or upsetting events. Loneliness and isolation. Cancer can make you feel very alone. Friends and family may not phone as often as you'd like or visit as often as you'd like. You may feel too sick to work and enjoy social activities. Even when you're with people, you may feel that no one understands what you're going through. Anxiety and stress is an important point to note. When you are anxious, you have a sense of being uneasy, worried, or fearful about something. You may have symptoms like rapid breathing, an increased heart rate, or a feeling of butterflies in your stomach. You may feel dizzy or start sweating. You may also have problems concentrating or falling asleep when you feel anxious. Feeling anxious when you have cancer is normal. But sometimes anxiety can get so bad that it overwhelms you. When that happens, anxiety can be diagnosed as a medical condition that needs treatment. Stress is our body's way of reacting to something that we think is dangerous or that is a challenge to us. You might think of stress as something that's in your head, but it's a physical reaction that your body gets ready to run away from the danger of or to fight it. Depression. Depression, many people feel unhappy, tearful, hopeless, or discouraged at times when they have cancer. These feelings are normal. But if they don't go away or last a long time, get worse, or get in the way of your day-to-day life, they could be a sign of depression. If this is the case, it's important to have communication with your doctor or advanced nurse practitioner about your feelings so that they can be addressed and treated adequately. The last feeling that we'll address in this slide is hope. Hope is the feeling of wanting something to happen. Some people find it easy to be hopeful. It helps them cope with the hard things happening right now. But you may find it hard to have any hope in what is a tough experience, and that's okay. You don't have to pretend to feel a certain way if you don't. Here are some ways to cope with your emotions. It's important to express your feelings. People have found when they express strong feelings like anger or sadness, they're more able to let go of them. Some sort out their feelings by talking to friends or family. Other cancer survivors appreciate a support group and being able to be surrounded by people that can relate to their journey. Look for the positive. Sometimes this means looking for the good even in a bad time, or trying to be hopeful instead of thinking the worst. Do the best that you can to focus your energy on wellness and what you can do now to stay as healthy as possible. Don't blame yourself for your cancer. Some people believe they got cancer because of something they did or did not do. But scientists don't know why one person gets cancer and one person doesn't. All bodies are different. Remember, cancer can happen to anyone. Don't try to be upbeat if you're not. Many people say they want to have the freedom to give into their feelings. As one woman said, when it hurts, when it gets really bad, I just tell my family I'm having a bad cancer day and I go upstairs and crawl into bed. Understand that you have the right to do that. You don't have to be anything or look any certain way to accommodate the feelings of others or their comfort level. And remember, you choose when to talk about your cancer. It can be hard for people to know how to talk about your cancer, and often loved ones mean well, but they don't know what to say or how to act. You can make them feel more at ease by asking them what they think or how they feel, but that's your choice. Find ways to help yourself relax. Whatever activity helps you unwind, you should take time to do it. Meditation, guided imagery, and relaxation exercise are just a few ways that have been shown to help others, and these may help you relax when you feel worried. Be as active as you can. Getting out of the house and doing something can help you focus on other things besides cancer and the worries it brings. Exercise or gentle yoga and stretching can help as well. Look at things that you enjoy. You may have hobbies such as woodworking or photography or reading or crafts. Find creative outlets such as art, movies, music, or dance that make you feel good. And last, but certainly not least, it's important to look at what you can control. Some people say that putting their lives in order helps. Being involved in your health care, keeping your appointments, and making changes in your lifestyle are among the things that you can control. Even setting a daily schedule can give you a sense of control. And while no one can control every thought, some say they try not to dwell on the fearful ones, but instead do what they can to enjoy the positive parts of life. Now we're going to address the side effects of cancer treatment, more specifically, chemotherapy. In talking with patients that have cancer, I have found that the most prevalent symptom of cancer treatment that they experience is fatigue. It's important to remember to take it easy. Fatigue is one of the most common and difficult side effects of chemo. It's usually worse at the beginning and end of a treatment cycle. Planning ahead and making conscious decisions about your activities and how you Order your day will make a big difference in how you feel. To keep your fatigue at a minimum, don't try to do it all. Accept help with shopping, housework, cooking, and driving. Get plenty of sleep. If you have trouble sleeping, tell your doctor. Set aside time each day to rest. Limit your activities. Consciously think about your priorities. Ask your doctor about exercise. Eat a well-balanced diet. Drink plenty of non-carbonated fluids. Get up slowly from lying or sitting to prevent dizziness. This includes memory lapses, trouble concentrating, being able to remember details, the inability to multitask, and difficulty remembering common words. This will go away. To help manage it, try the following. Rest often and get plenty of sleep. Exercise as much as you are able. Get a weekly pill dispenser so you don't get your meds mixed up. Use a daily planner. Establish routines. Don't try to multitask. Focus on one thing at a time. Exercise your brain with puzzles, Sudoku, or learning a new language. Tell people so they will understand. Call your most forgetful friend or relative and swap stories. Pain. Some of the side effects you may experience with chemo are associated with pain. These include joint and muscle aches, headaches, burning and tingling in your hands and feet, and stomach pain. Your pain could also be from the cancer itself, and your doctor can prescribe medication to ease your discomfort. If you have pain all of the time, take your medication regularly and on time. If you skip doses and the pain gets severe, it will be very much more difficult to control. If your pain is mild or occasional, you may only need to take the medication later in the day or before bed. Pain management can also be helped through deep breathing exercises, yoga, massage, reflexology, and acupuncture. Hair loss. Losing your hair to chemo is a hugely emotional experience and probably the one side effect that people worry about the most. It's easy to understand why. Even on the worst of hair days, we still have our hair. Accepting hair loss as part of your journey can be devastating. Just try to keep in mind that if you do lose your hair, the loss is temporary and it will grow back. If hair loss is one of your side effects of your chemotherapy, it will usually start around 10 to 14 days after your first round of chemo. You may notice clumps in the shower, in your brush, or around your pillow. Some people find it helpful to cut their hair very short, about 1 inch, all over. This is easier to handle than losing long clumps of hair when the shorter hair starts getting too patchy. Just shave it all off. Believe it or not, this looks and feels a lot better than you might think. If you do decide to shave your head, be sure to have a friend at your side who will not only support you, but make you laugh. When your hair starts growing back, don't be surprised if the color and texture are different. Who knows? You just might get the curls you always dreamed of. Nausea and vomiting. Most chemo patients get nauseated and may throw up. Many drugs are able to prevent and treat nausea and vomiting, so call your doctor and find the one that may work for you. You should also try the following. Wear loose-fitting clothes. Don't go to chemo on an empty stomach. Eat small, frequent meals. Stay away from sweet, fried, and fatty foods. Eat cold or room temperature foods. They have fewer strong smells. Chew your food well. Eat and drink slowly. Drink liquids an hour before and after meals, not with meals. Drink cool, non-carbonated liquids. Suck on ice cubes and regular or ginger mints. Refrain from laying down for 2 hours after eating. Keep in mind that although it may not feel like it, this will pass. Intestinal problems. During chemo, good cells in your body, like those in the intestinal lining, are destroyed, and that can lead to diarrhea and constipation. Frequent diarrhea causes dehydration and weight loss. It's disruptive to your daily activities and adds to your fatigue. Your doctor can order medication for you if this becomes a problem. To avoid diarrhea or ease the discomfort, eat small amounts frequently. Avoid coffee, tea, sweets, and dairy products. Avoid high fiber foods. Increase your amount of low fiber foods. Follow the BRAT diet: bananas, white rice, applesauce, toast as a start. Changes in appetite. In one way or another, your appetite will probably be affected by chemo, so it's important to plan ahead and be creative in finding foods that you enjoy eating. You may not be able to eat due to nausea, sores in your mouth, depression, and/or fatigue. Chemo also causes food to taste differently. Sometimes it's too sweet or too bitter, and it may have or leave a metallic taste in your mouth. Some people even temporarily lose their sense of taste, which also makes eating difficult. To ease your changing appetite, take a walk before meals. Rinse your mouth out before meals. Eat smaller, more frequent meals and snacks. Make sure to eat plenty of protein. Try new foods and recipes. Change your routine by trying new places to eat. Avoid concentrated sweet or sour foods. Dilute sweet beverages with water. Use plastic spoons, knives, and forks if a metallic taste becomes a problem. And call friends and family and ask them to bring over their favorite dish. Try each one. Mouth sores and dry mouth. So mouth sores are common during chemo and can affect your nutrition and cause pain if they get severe. Plan ahead and be ready using the following tips. Apply cold sore medication to sores immediately after they develop. Use Cool Mint Chloroseptic sore throat spray. Rinse with a solution of 1 cup water, 1 teaspoon baking soda, and 1 teaspoon salt. Do this after meals and before bedtime. Increase this to 2 hours while awake if necessary. Drink plenty of liquids using a straw to bypass the sores. Eat cold or room temperature foods. Eat soft foods such as scrambled eggs, mashed potatoes, yogurt, pudding, milkshakes. Cook cereal and soups. Dip hard food in liquid or blend your food if necessary. Avoid acidic, salty, spicy, rough, coarse, and dry foods. Suck on ice, popsicles, or sugarless hard candy. And if you smoke, stop. Skin and nail problems. It's not unusual to have skin problems such as redness, itching, acne, dryness, or peeling during chemo treatments. Blistering and peeling of the hands and feet are also common. This can be prevented by avoiding heat or friction to the hands and feet the day before and 3 days after a treatment. You may also notice a dark line up the vein where you get chemo. Don't worry, this will eventually go away. Your skin will be more sensitive to the sun than ever before, so make sure you use sunblock, skin protection. Nails may become brittle and break more easily. To treat these conditions, keep your face clean and dry. Apply cornstarch to itchy skin. Take shorter warm showers instead of longer hot ones. And apply lotion or oil while your skin is still damp. Use moisturizers on your face as well as a deeply hydrating mask. Avoid perfume and cologne as they contain alcohol, which is drying. Use sunscreen and wear long sleeves, pants, and a hat when outdoors. Get manicures and pedicures regularly, selecting a salon with high sanitation standards to prevent infection. Prevent blisters on your feet with well-fitting shoes. Wear socks or shoes at all times to protect the tender skin of your feet. There's also going to be changes in blood cell count. As you receive chemotherapy, it may affect your blood platelets and white blood cell counts. While chemo works hard to kill your cancer cells, it can also leave your blood counts low, causing an array of additional side effects. Our bone marrow continually produces 3 types of blood cells: red blood cells, white blood cells, and platelets, and each serves a unique purpose. During chemo, bone marrow is suppressed, so it produces fewer blood cells. This is what leads to low blood cell counts. Your doctor may give you a medication to prevent or treat any changes in your blood cell count. If you have any questions, ask your provider about this. Red blood cells carry oxygen in your blood. If they are low, your heart will have to work harder to get enough oxygen to your body. This in turn will cause fatigue, dizziness, weakness, pounding or fast heart rate, shortness of breath, pale skin, or feeling cold. White blood cells are the army that fights infection. A decrease in these cells makes it more difficult for your body to fight bacteria that cause infections. If this number drops too low, chemo may be delayed or your medication may be adjusted. What to bring to chemotherapy? It's advisable to find a comfortable bag or backpack that you carry back and forth to chemotherapy with you. This will help your experience be more comfortable and relaxing. A great way to help you manage your treatment is by creating a bag of personal things that will help keep you comfortable during your chemo days. Here are some suggestions to get you started. A water bottle. It is imperative to keep and stay hydrated. Saltine crackers may fight off the metallic taste that chemo can cause. Regular or ginger mints can calm an upset stomach. Lip balm or lip gloss may help keep your lips hydrated and keep the mouth sores at bay. Blanket, socks, and a sweater. Chemo units get cold, and some of the drugs that you may be administered during chemotherapy can cause a sensation that will make you feel cold. A small pillow or neck roll, a personal music player, a book of crossword puzzles or Sudoku puzzles, or even just a book to read. DVDs. Some facilities have TVs. Others have DVD players. It all depends on where you're being treated and what is available in the area where you're being treated. And last but not least, if it's allowed, it is always beneficial to bring a close friend or family member. Just keep in mind that they may not always fit in your chemo care bag. Mindfulness. Mindfulness is slowing down to pay attention to what's going on right here, right now. And some of the benefits of mindfulness are that it reduces the stress, anxiety, and depression. Being mindful can minimize some of the overwhelming emotions that you experience while you're undergoing treatment for cancer, while you're navigating treatment for cancer, or after you've found out about your diagnosis. It increases a positive emotions and enjoyment in daily life. It encourages healthier eating habits and it may improve your relationships as well. This slide addresses a simple way to practice mindfulness. Keep in mind that mindfulness is not an easy thing for some of us because we have so much going on in our minds, so many thoughts. These can be hard to calm, quiet, or tame. So be patient with yourself and remember that this is a work in progress. So start just by taking a seat. Find a place that feels calm and quiet and peaceful for you. Remember, this is about your peace of mind. Set a time limit. If you're just beginning, it can help to choose a short time, such as 5 or 10 minutes. Build on that. Build on the time that you start at. Notice your body. You can sit in a chair with your feet on the floor. You can sit loosely cross-legged in lotus position. You can kneel, all are fine. Just make sure that you are stable and in a position you can stay in for a while that is comfortable for you. Feel your breath. Follow the sensation of your breath as it goes out and as it goes in, as you inhale and exhale. Nice, long, slow, deep breaths. Notice when your mind has wandered. Inevitably, your attention will leave the sensations of breathing and wander to other places. When you get around to noticing this, in a few seconds, a minute, 5 minutes, simply return your attention to breathing. Remember, the point is to be in the moment or the moments. Be kind to your wandering mind. This is the most important thing. Don't judge yourself or obsess over the content of the thought you find yourself in. Just come back as it's comfortable to you. This is about you and your space and your mindfulness, relaxation, and breathing. That's it. That's the practice. You go away, you come back, and you try to do it in as kind and gentle a manner as possible. Learning to relax can be hard. Here are some starter ideas that may be helpful for you or your family members. A massage. Massage can be very relaxing. It can be nice to lay on a table and just to feel a calm, gentle touch on the parts of your body that you're comfortable with. Remember, this can be done clothed or unclothed. You only undress to your comfort level, and always make sure to inform the massage therapist if there are any parts of your body that you do not feel comfortable being touched, or if you have pain somewhere, or if you would specifically like them to address one area. Reflexology is a type of massage that concentrates on pressure points in the hands and feet. They correspond with, it's believed that they correspond with a specific organ in the body. So reflexology is done on the hands and feet, sometimes on the ears, as there are pressure points in the ears as well. That's referred to as auricular therapy. Reiki. Reiki is an ancient Japanese modality that focuses on breathing, grounding, and centering. It is less invasive than a massage. So if you're not comfortable being touched all over your body, you may find Reiki is more helpful for you than massage. Yoga. Yoga is excellent to help you cope with fatigue and helps you to gently stretch your body. It can be adapted to your skill level if needed. It can be done seated. The stretches can be gentle. And again, it takes you back to sort of a mindful mentality where you focus on slow, gradual movement and breathing. Breathing exercises. It can be just as simple. If you struggle with mindfulness, if you struggle to relax in other ways, just slowing down and taking a few deep breaths can be helpful in helping you, assisting you to get to a more relaxed state. Guided imagery can help as well. This is available on several apps that you can find on your tablet or cell phone. You can also find videos on YouTube that will guide you through a relaxing place or describe a relaxing state of mind or help guide you into a mindful state. There are other ways to cope. So there are other ways to deal with your emotions. Talk about your feelings no matter what they are. No matter what they are. Find a friend, family member, or loved one that you trust and tell them how you feel. Stay active and eat balanced meals. Nutrition is important. It's important to remember that a body in motion stays in motion. Treat yourself to things you enjoy, like a hot bath, a nap, or your favorite foods. Go to a movie, out to dinner, or to a game. Remember, your social relationships are still important. Get help with everyday jobs like cooking and cleaning. Some people find it hard to ask for help, but it can be important if you're experiencing fatigue to ask for assistance if you need them in your activities of daily living. Don't try to do it all yourself. Don't try to force yourself to be happy. Don't try to do too much in one day. Don't give up your healthy habits. This is all very important. If you need more information, assistance, or support, you're welcome to contact us at Home of Hope Cancer Wellness Center. We're located at 1637 Plock Drive, Dixon, Illinois, 61021. We can be found on the World Wide Web at homeofhopeonline.org. Our offices can be reached at 815-288-4673. I'm Claire Bianco. I'm the Client Services Coordinator at Home of Hope. I'd be happy to assist you with anything that you need at any time. And remember, we're a United Way organization. Thank you so much for taking the time to watch this video, and we wish you well.